Good afternoon. At the outset, I would like to thank the panel for the opportunity. At this amazing platform, I would like to introduce this novel virtual simulator for refractive surgery counseling. No financial interest to disclose. Traditional counseling has a lot of limitations. So how can we apply modern day counseling into our practice? Can the counseling be as easy as playing a video game? What if, before surgery, the patients could be transported to virtual world? They could connect and interact with simulations of common scenario. And it wouldn't be wonderful if they could test drive their eyes before surgery. So the research question we had in our mind was, can we link ophthalmic counseling to virtual reality? After many sessions of thinking and execution, we modified an existing virtual reality device. And with a unique proprietary software, we finally came up with what we call a virtual counselor. Again, no financial disclosure. Let me show you how it works. What does this virtual counselor do? It has basically two arms. One is counseling, and it has an added advantage of testing the optics of the eye. Present day laser surgery is very expensive, and patients are often apprehensive how the results will be. Objectively, Xywave can measure these abrasions, and by knocking off some, it gives the effect on point spread function. But subjectively, how do we measure this is the big question. Can we actually make the patients to see these abrasions and decide what is good? So in our software, we incorporated Zernike's polynomials, which is attached to a computer device. It is a patented technology. And in this screen, we can actually tweak in the abrasions. We can correct the lower order abrasions. We can correct the higher order abrasions and show it to the patient and let him decide what works best for him. VR is used in health sector in many, many ways. And let us see some more applications in ophthalmology. It can be used in refractive surgery and in pre-presbyopic population who desires correction. This VR simulator gives an effective 3D environment to the patient where he can actually view binocularly. He can interact with the things real time. He can decide whether abrasion induced or abrasion free, which works best for him. For example, in this patient, we added the spherical abrasion and noticed whether he's feeling improvement in the depth of focus. This will help in a guide whether he's a good presbyopic surgery candidate. Other applications are the lens-based procedure, where we can decide whether a monofocal profile is good for the patient or a multifocal. And even we can simulate a monovision profile for the patient. Multifocality is associated with glares, halos, and night vision problem. We all know this. So we tried, interestingly, this one particular thing, we tried to incorporate various day-to-day scenarios in our simulator, which gives the feel of the glare, halos, and night vision problems. Because counseling is not only about telling the advantage of the surgery to the patient, but it's also about explaining the minimal and the potential side effects of the surgery. So various topographers, abrometer gives the confidence to the surgeon about the procedure, whereas this novel virtual simulator and counselor will give the confidence to the patient about the procedure and will help in increasing the acceptability of the procedure. Our vision is to create a counselor which can portray all the possible complications to the patient, like glare, starburst, and contrast sensitivity loss. This will definitely make us better and safe surgeons and have better confidence in our patients. So this is where the future of virtual counselor lies, and the journey has just begun. I'd like all of you to suggest what all we can do to fine-tune it. Thank you.